Hi, Dr. Reddy with Digestive Disease Consultants here in Altamont Springs. I wanted to share with you some recent updates on colon cancer screening recommendations. I also have the pleasure of serving on the Orlando board of the American Cancer Society. And at the end of May, starting in June, we've updated our guidelines and recommendations for patients at average risk for colorectal cancer when they should start getting screened. And I think that's something that I'm getting a lot of questions about, and I think you might encounter that in reading that you do in the press, and I think it's important to go over some key points. So first of all, I think it's important to understand that if you're having symptoms, any change in your digestive health, any cause for concern, any cause for alarm, the most important thing is that you need to have a conversation with your doctor, and they could advise you how to best approach that from a cancer prevention standpoint. But focusing in on patients who feel well, who don't have any specific health complaints, the idea of cancer screening is very important. Based on a review that was recently published in the Journal of the National Cancer Institute, looking at data on over 500,000 patients from 1890 to 1990, so it's a huge span of time, it's been determined that recent changes in the incidence of colon and rectal cancer are very important and a little bit unexpected and have changed the way we look at the cancer prevention landscape. So previously, we've always recommended that we start screening for colon cancer at the age of 50. Advances in cancer prevention and early detection and treatment have dramatically reduced the incidence of colon cancer in the age 55 plus population. However, what we found recently is that from patients age 40 to 55, incidence of cancer has actually increased. Based on review of the data, based on changing trends in cancer occurrence, we now feel that age 45 is the appropriate age to start screening for colon cancer. Now, this comes out of the American Cancer Society, which has very well-established published guidelines on screening methods for different sorts of cancers, different parts of the body. There are a variety of screening tests that apply to colorectal cancer as well. So the most important thing is have a conversation with your doctor. Of course, any test or procedure, you need to check with your insurance company as far as payment, benefits, coverage, issues like that. But from a medical standpoint, I'm happy to announce that the new guidelines are out, and please feel free to contact us if you have any questions or concerns, or have a conversation with your doctor.